actually had two different things we were trying to balance. The risk of going too early, in which case you get all the damages from this with actually fairly minimal impact on the epidemic, and the risk of going too late, in which case you get all the problems of the pandemic running away. Now, as we will, I'm sure, come on to, my view is, with the benefit of hindsight, we went a bit too late on the first wave, and I've been very clear about that for some time.
Well, our health correspondent Ashish Joshi joins us live now from central London. And Ashish, Hugo Keith, Katie, lead counsel to the inquiry, been pushing Chris Whitty quite strongly this morning, but Chris Whitty sort of quite a strong defender of decisions that were made.
Yes, that's been the theme this morning, Jane. Hugo Keith clearly trying to explore this line that was presented yesterday by Sir Patrick Vallance, the chief scientific advisor at the time, who suggested that he was in the camp that wanted to go hard and go fast very early on in the pandemic, and there was quite some pushback from ministers and senior government advisors, and also from the chief medical officer, Chris Whitty, at the time, who was concerned about the wider impacts on the population, about health outcomes which would be felt if lockdown was imposed too soon. Very early on in the session, Chris Whitty dispelled any notion that there was a rift between him and Sir Patrick Vallance. He said this was absolutely normal, it was natural. There was Sir Patrick Vallance talking about the scientific impact and why interventions, non-pharmaceutical interventions, would be required, and why, in his role as Chief Medical Officer, Chris Whitty had to argue about the wider health implications, the impact on our mental health, the impact of isolation, and especially the widening of health inequalities. And as you said, right throughout this morning's session, he has been defending his line. He said when he was presented with the evidence, even by Professor Jonathan Van Tam, who had been alerted to this rise in cases and the worrying cases in China, even in January, Professor Chris Whitty said it was too soon given the evidence he had at the time. And in retrospect and in hindsight, he has been on the record as saying he does think the UK acted too slowly by the time of the first lockdown. But certainly in January, he said if he were presented with the same evidence again, he would stay in the same position, i.e. he made the right call at the time, given the evidence that was presented to him. We don't get much of the detail about any tensions that might have existed like we did yesterday. So Chris Whitty plays it very straight. He sticks to the medical facts. He doesn't opine. He doesn't talk about personalities. But there was one moment when you began to understand how he felt as the chief medical officer when he was talking about science and the facts and how the government, and he said not the Prime Minister or senior ministers, but members of the government would cherry-pick the science to suit their own political agendas. And this is what he said about the slogan and being presented as a public face of the government's science.
Both Sir Patrick and I, when it initially happened, remembering that our job was to get science into government, thought, oh, this is a good thing. Government is recognising that science is important. Very soon we realised it was a millstone around our necks and didn't help government either, because it blurred the distinction between the very firm, clear demarcation that must and did exist between technical advice and political decision, for which people are then answerable in the ballot box and in Parliament.
He didn't elaborate on who those politicians might have been who chose to cherry-pick the science, but he did say it wasn't Boris Johnson, it wasn't any of the senior cabinet ministers, but certainly an indication that there was some tension between the scientists and the politicians.